Hello, my name is Anthony Dulgeroff. I'm an endocrinologist at High Desert Medical Group, and I'm also the Associate Medical Director. I've been here for almost 22 years now, and I've seen a lot of changes over the years. Many good, but some not so good, in particular with the incidence of diabetes, which is why I'm talking to everybody today. When I came here, I saw diabetes on fairly regular basis, but not nearly as much as now. In fact, the current statistic is nearly 50% of the population of the United States has either diabetes or pre-diabetes, and 1 in 4 people over the age of 60 has type 2 diabetes. Fortunately, we can change this. We can change the incidence of diabetes. We can change how the outcomes are. In particular, diet. Diet is one of the main influences of diabetes. Now, when you drive around this town, and any town in the United States now, you'll see a lot of fast food chains. My recommendation is drive past these places. While the food is very delicious, it's not necessarily nutritious or good for you. The other thing I've noticed is that portion sizes in the United States have increased tremendously over the last several years. What we've seen is portions go from plates to platters and too many calories, and this is really contributing to type 2 diabetes occurrence. So what I tell my patients when they have diabetes, first thing they have to do is look at what they're eating. Try to eat 3 meals a day. Don't skip meals. When you skip meals, you tend to eat maybe not the best food in the world because you're so hungry later in the day when you skip meals. What I like to recommend is that people just eat what looks like food. It isn't processed. It looks like there are carrots out there. Eat carrots. There's salad out there. Eat salad. Diet isn't the only thing that's important for diabetes. Exercise. The mechanism of type 2 diabetes is insulin resistance, and insulin resistance is treated by exercise. When somebody exercises, what happens is glucose that's circulating around the bloodstream is able to enter the cells and be stored as energy much better. So when I see a diabetic patient, in addition to the diet, I recommend routine exercise 3 to 4 times per week. Aerobic exercise, brisk walking, an exercise bike, a treadmill, anything that gets the heart pumping, and do it on a regular basis, no matter what. No excuses. Now, there have been many strides made in newer diabetic medications. There are a plethora of new medications available. It used to be a lot of the medications were very weight gaining, including insulin. We still use insulin. It's still one of the best medications for diabetes. But as endocrinologists, we try to avoid insulin so we don't have excess weight gain, if at all possible. And many of the newer medications do just that. They lower blood sugars without causing weight gain. So it's been nice to see these come along. Something as simple as a small injection once a week can lead to weight loss, and it can lead to improvement in diabetic numbers and blood sugars and the hemoglobin A1Cs, in addition to reducing cardiovascular risk. And one of the things associated with diabetes, and this is why we're doing all of this, is because diabetes, it's usually not the diabetes itself that causes the problems, it's the outcomes of it. Diabetes that's left uncontrolled for several years can lead to cardiovascular disease, heart attacks, and strokes. Those are bad. We want to prevent those, and by controlling the diabetes, we can prevent this.